Hi guys, I'm jumping on this morning to demystify the muscle piriformis. This is one of my favorite muscles around the hips and the pelvis, and it's a muscle that sometimes confuses people, both patients and clinicians alike. So what I wanted to do was just have a little discussion about some of the parts of piriformis that I find helpful to remember when I'm in clinical practice. Okay, so the first thing is we want to know where piriformis is and what it attaches to in the body. So it's a muscle that attaches from the sacrum or the tailbone, and it comes off the side and wraps around to the left hip, and then you have one on the right side from the sacrum that wraps around and attaches to the right hip. So it's actually on the inside of the pelvis. So if you think about my hand and pretend that it was the tailbone or the sacrum, and from the tailbone and the sacrum, the rest of the spine comes up and connects, piriformis is actually attached to the front surface of the sacrum, and it comes down and attaches the left one to the left hip, and on the right hand side it comes down and attaches the right one to the right hip. So this is important to know because it gives you an indication of when it's not doing the best it could do, what it does to the pelvis. So if we have a left piriformis that is tight, usually what happens is it gets tight, and it starts to pull the pelvis towards the left-hand side. So often if your left piriformis is tight, your pelvis or your tailbone, sacrum, will be rotated towards the left. Vice versa, if your right piriformis is tight, it will have the opposite effect. Often it will start to pull the sacrum towards the right-hand side, towards the right hip. Now, sometimes we get asked the question, what if both piriformis are tight? So your left and right piriformis are both tight. And this is actually fairly uncommon because most of the time, the reason piriformis is tight or hypertonic is usually to compensate for something else going on around the body. And it doesn't make much sense for the body to make both piriformis muscles tight because it won't really move the pelvis in any which way direction. It will just hold the pelvis very stable. So this really doesn't happen very often. Usually both piriformis are maintaining a really great neutral position and the pelvis is neutral, which is fantastic. Or the more likely situation when you've got SIJ pain is that one piriformis is more tight than the other, and the tight one, as you now know, will often rotate the pelvis towards that tight side. So I hope that was helpful. There's lots of other bits and pieces we can talk about in terms of how to release piriformis, or when you're doing a clinical assessment on a pelvis, other things that piriformis might indicate, but I'm going to save that video for another day. Okay guys, I'll talk to you later. Bye.